Hey there. So, as a certified nurse assistant, you're in a position of huge trust. Today, we're going to break down one of your most critical jobs, understanding and protecting patient rights. This isn't just about following rules, it's about honoring the person in your care. Okay, let's dive right in. This idea right here, it's really the heart of everything you do. It's a reminder that every person we care for has a life, a history, and a whole world outside the walls of a facility. Our job is to see that whole person and give them care that respects every single part of their humanity.
That's the big question, right? What is your part in all of this? Because let me tell you, your role goes way, way beyond just the physical tasks. You are an advocate, a guardian, and a lot of times you're the first line of defense for a person's dignity and safety.
Okay, so to be a great guardian, we've got to start by understanding what every single person needs to feel safe, to feel valued, and to feel whole. And it goes so much deeper than just medical care. You've probably seen Maslow's hierarchy before, right? But here's what's so cool about it. Look how it maps directly to your day-to-day work. You're making sure those physiological needs are met with every meal, every time you help someone get comfortable. You're creating safety when you answer a call late quickly. You foster belonging by encouraging family visits and just showing you care. You're building self-esteem every time you help someone do something for themselves. Your care literally helps people live their fullest lives. So, building on that idea of human needs, we get to something super important. These needs aren't just suggestions. Nope, they're actually protected by some powerful legal and ethical shields. Let's take a look at these rights that are absolutely non-negotiable.
Okay, these are the big ones, the absolute cornerstones of patient care. Dignity? That means treating people with respect, plain and simple. Privacy? That's about knocking on doors and keeping bodies covered. Informed consent means they get a say in their own care. Freedom from abuse is, well, it's absolute. And the right to have a grievance heard means their voice matters, and they won't be punished for speaking up.
So what happens when these rights get violated? Well, harm occurs. But here's the thing. It's not always a black eye or a broken bone. Harm can be really subtle, and it's so important that we recognize its different forms so we can stop them.
First up, let's get crystal clear on abuse. The key word here, and I mean the key word, is willful. This is an intentional act. It's a deliberate choice someone makes to cause harm, whether it's physical, psychological, or even financial.
Now, neglect is different. It's all about inaction. It's a failure to provide the care someone needs, like food, water, or help with hygiene. The result can be just as awful, but it comes from not doing something you were supposed to do. And then we have negligence. This one's all about professional standards. It's when a caregiver, maybe without even meaning to, doesn't provide the level of care that any other trained professional would, and that failure could lead to harm.
Okay, let's put it side by side to really nail this down. Negligence is unintentional. It's a mistake, a failure to meet a professional standard. But abuse, that's willful. It's on purpose. Getting this difference is absolutely critical for you.
All right, so we've defined the rights, and we've talked about the different kinds of harm. Now, let's shift gears and focus on your most important role, your legal duty to be a protector. And I really want this to sink in. This isn't a choice. It's not a suggestion. It is a legal requirement of your job, period. So, as a CNA, you are what's called a mandated reporter, and that means the law requires you to report any, and I mean any, suspicion of abuse or neglect. You don't have to be a detective, you don't need proof, you just need a reasonable suspicion. Your job is to see it and say something, not to investigate it yourself. This slide really wraps it all up, doesn't it? It's like a constant cycle. You uphold their rights, you know the rules, you create a safe space, you document everything properly, and, this is the big one, when you suspect something's not right, you report it.
Look, I get it. This can all sound pretty heavy, maybe even a little overwhelming. But here's the most important thing to remember. You are not alone in this. There's a support system designed to help you and to fight for the patient.
So, when you see something, when you have a concern, who do you turn to? Who's got your back? And more importantly, the patient's back when their rights are at risk. Meet the Ombudsman. This person is an independent advocate for residents. They don't work for the facility, which is key. Their only job is to protect the patient. Think of them as your most powerful ally in making sure patient rights are respected. So what do? Well, think of them as an expert problem solver.
They're there to investigate complaints, to help resolve conflicts between patients and the facility, and to educate everyone about what a patient's rights actually are. They are an absolutely essential resource for you. When you boil it all down, all the theories, all the rules, all the resources, it really comes down to you. It's your attention to detail during a routine task, your compassion in a tough moment, and your courage to speak up that really protects a person's dignity. Your vigilance is their shield. It's as simple and as profound as that. So that's the real question, isn't it? The one to carry with you into every single shift. How are you going to make sure you're always listening? Not just to what people say, but to what they don't say, to a change in their mood or behavior. Your job as a guardian is active, it's constant, and honestly, it's the most important work you will ever do.
Thank you for watching. We hope you found this video helpful. Don't forget to subscribe and follow us for more nursing educational videos.